You know, in a couple of communities in Massachusetts, something really special is happening. There's a compassionate approach to addiction that is actually changing lives. It's a strategy that looks past the stigma to treat the whole person. So we're going to dive into what's being called the Fitzgerald Factor and see what makes the Heywood Medical Group's philosophy so incredibly successful.
Okay, let's start with just one number, 5%. That's the official statistic in Massachusetts for people who are actively seeking help for addiction. Now think about that. That's 1 in every 20 people. That's a huge number on its own, right? But believe it or not, that's really just the beginning of the story.
Right, because that 5%, it's just the tip of the iceberg. I mean, think about it. Those are only the people who have actually raised their hand and asked for help. The reality is, so many others are out there struggling completely in silence because they're afraid of being judged or they're just ashamed.
And this gets to a really crucial point. This is not some fringe issue for a handful of people. No way. This is a challenge that touches pretty much everyone, which is why we're talking about it as a fundamental part of the human condition.
Wow, this quote from Dr. Fitzgerald, it just hits the nail on the head, doesn't it? It's not some scary Larry down on the street. It shatters that old stereotype of what addiction looks like. The truth is, everyone has someone in their family or in their circle of friends or at work. It's an issue that connects all of us.
So this leads to a really big question, right? If this is so common, why is it still so hard to talk about? Why all the silence? Well, the answer comes down to some really tough barriers that keep people from reaching out. Okay, let's break these barriers down. First and foremost, there's the fear of being judged, of being shamed. Then there's this really deep-seated belief that it's a moral failing, not a real illness. And that way of thinking just creates this intense isolation where you feel totally alone and have no idea where to even start. And get this, even some doctors can get, well, squeamish about it. They hesitate to bring it up, which is just incredible when you think about it.
All right, so this is where Heywood Medical Group comes in and just flips the script. They're pioneering a new philosophy of care, and it's all about treating the person, not the stigma. They're completely reframing the conversation, moving it away from judgment and squarely into the world of support.
And it all starts with something so simple yet so powerful, a new definition. Forget all the complicated medical jargon. They just ask a very direct question. Is there a substance or behavior that's negatively impacting your life, but you feel like you just can't stop? What's brilliant about this is that it can apply to anything. Alcohol, sure, but also social media, gambling. It makes the whole idea instantly understandable.
And this message, this is really the core of everything they do. You are not a bad person, you have a medical illness. This simple statement changes everything. Suddenly, it's not a moral issue anymore, it's a medical one. And the key is to treat it just like you would any other chronic condition, like diabetes or heart disease. It's not about having a weak character, it's about having a treatable illness, period.
So you can see how this philosophy totally changes this strategy on the ground. The old way, it was all about stigma and shame. Doctors were hesitant. You basically waited for a crisis to happen. But the Heywood way is the total opposite. It's about making this a normal conversation. They do universal screening for everybody. They intervene proactively before a crisis hits. And maybe most importantly, the treatment is all about what the patient wants to achieve. It's about their goals.
And here's another key insight that their approach is built on. Substance use is almost never the real problem. It's usually a symptom of something deeper. People are often trying to, fill a void. They're self-medicating for things like depression, anxiety, or past trauma. So if you really want to help, you can't just focus on the behavior. You have to get to the root cause.
All right, so let's talk about compassion in practice. How does all this actually work? Because this isn't just a philosophy on paper. Heywood has created some really innovative programs that bring this compassionate care to life for their patients.
Which brings up a huge challenge, right? If people feel too ashamed or too alone to even ask for help, how in the world do you reach them? Well, one of Heywood's solutions is it's brilliant in its simplicity. They noticed a major disconnect. You had patients in the hospital for all sorts of related issues, but they were never getting referred for addiction care. So they decided to meet patients right where they already were, in the hospital. A specialist actually goes to the patient's room during their stay, starts a supportive, non-judgmental conversation, and creates this seamless bridge from their hospital bed right into outpatient care. It's genius.
And the real power here is that this model is proactive, not reactive. See, instead of waiting for someone to hit rock bottom or have a major crisis, this approach starts the conversation early.
It basically creates a safety net to catch people who, in the old system, would have just fallen right through the cracks.
Okay, so this all leads to the most important part. What does this mean for you or for someone you love? What's the first step? The good news is, the path forward is often a lot clearer and easier to access than you might think.
So, how do you get started? Honestly, the very first step is just admitting to yourself that you want to make a change. That's it. From there, talk to your primary care doctor. And please know that conversation is totally safe and confidential. Now, if for some reason your doctor doesn't seem comfortable with the topic, don't be afraid to ask for a referral. And hey, if you don't even have a doctor, you can just call Heywood directly. Their door is always open.
And I think we should end on this simple but incredibly powerful message from Dr. Fitzgerald. You have the power to change. Just let that sink in for a second. It's a reminder that no matter what the circumstances are, no matter how hopeless things might feel, recovery is absolutely possible. That power to start the journey, it's inside every single one of us.
Look, this model of care is so much more than just a theory. It's a team of real people, right now, who are ready to help. If you want to learn more about these amazing, compassionate professionals at Heywood, please visit their website. And just remember this, the journey to recovery might be personal, but you absolutely do not have to walk it alone.